morning, Miss Smith. My name's Alyssa. I'm your nurse today. I've come in to do some suctioning for your trach. I'm just going to check your wristband, make sure you're the correct patient. Can I get a first and last name and date of birth? And do you have any allergies? Okay, perfect. All right, first I want you to do a deep cough for me so we can try to open up those secretions. And then I'm going to listen to your lungs and determine the need for suctioning. Okay, I definitely see a need for suctioning, so I'm going to hyperoxygenate you, and I'm going to turn on the suction and get my suction tubing next to you. All right, now I'm going to prepare my equipment. I'll be right back. Okay, preparing my sterile field. Okay, I'm now sterile. I'm going to grab my suction tubing, keeping it coiled in my hand. Then I'm going to connect to the suction with my non-dominant hand. Okay. Now I'm going to test the suction in the saline, and it is working. All right, Miss Smith, we're going to start with the suctioning process. I'm going to remove your oxygen, and I'm going to insert this 6 to 8 inches into your trach without suction. Now I'm going to, while intermittently applying suction, I'm going to remove and apply suction for no more than 10 to 15 seconds while I'm rotating. Perfect. Okay, keeping this sterile, I'm going to do another respiratory assessment, determine if there's more need for suctioning. Okay, great, Miss Smith. I don't hear as many secretions, and I see that you're breathing a little bit better. I assessed you for signs and symptoms of hypoxia, and you're doing good. So I think we're good with the suction. So I'm going to just clean up my supplies, and now we're going to be doing some trach cleaning just to make sure you're all good and fresh. And just give me a few seconds to get my equipment ready. Okay. Going to dispose of all of this. And I'm going to apply sanitizer again. Next, I have my trach cleaning kit that I'm going to prepare. Creating my sterile field. And applying clean gloves to remove the trach. Going to place my sterile equipment on the tray. I'm going to apply water in my basin. Next, I'm going to remove the trach. All right, Miss Smith, I'm going to remove this for a second. Reapply the oxygen, and I'm going to place this in a clean basin. Okay. Next, I'm going to remove my clean gloves, and I'm going to apply my sterile gloves. Okay. Next, I'm going to take my sponge, and I'm going to insert into the trach to clean. I'm going to clean on the sides. Dispose of this. I'm going to take my dry tubing and I'm going to dry it, disposing of it. Now I'm going to place it back into Mrs. Smith's stoma. Perfect, Mrs. Smith, you're all clean. Now I'm going to take my toothpicks and I'm going to clean around the stoma. All right, Miss Smith, I'm going to clean around your stoma. I'm going to remove these old dressings. I'm going to assess your stoma, and I'm going to clean from inner to outer around the stoma. All right, perfect. Going to pat dry with a piece of gauze. Okay, next I'm going to replace your trach ties and get a fresh, clean pair. All right, I'm going to lift up your head. Okay, I'm going to remove the old one. Perfect. Now I'm going to place a new dressing around your stoma. And replace your oxygen. And now I'm going to do another respiratory assessment just to assess how you're doing. Great, Ms. Smith. I'm hearing a lot better lung sounds. I'm going to bring you back down to your normal oxygenation rate. Turn off my suction. Here is your call light. You please call me if you need anything. I'm going to go document these procedures and I will be back shortly. And I'm going to clean up my area and perform hand hygiene.